Okay, you are listening to Hall Monitor on WPPM 106.5 in Philadelphia. Tonight on the program, we have City Budget Director Marissa Waxman, Dale Mezzacappa of Chalkbeat Philadelphia, and Dr. Michael Lavasser, Professor of Epidemiology and Biostatistics at Drexel University. Okay, we are here on WPPM 106.5 in Philadelphia with Marissa Waxman, who is the Budget Director for the City of Philadelphia. Thank you so much for being with us.
Oh, thanks so much for having me.
So the first thing I'd like to ask you about, very briefly, can you explain how the city budget process works?
Sure. The first thing to know is there's actually a couple different budgets. We budget for all of our capital or infrastructure improvements, and that's in one fund, our capital budget, how much we're going to spend to renovate buildings or buy new buildings. And then we also have an operating budget, and that's where we pay for our day-to-day services, picking up the trash, firefighting, back office stuff like the procurement department. And there's a couple other funds too that have very specialized things. But each year, what happens is the mayor makes a proposal, comes up with what he thinks we should do. That proposal goes in front of city council. They consider it. There's usually some negotiating back and forth, but ultimately, we typically need to have that budget passed by the end of June because the new fiscal year starts on July 1. And if there's no budget in place, we can't spend a single penny, which is different than the state and federal governments. So we have a real pressure by law to get that done. And then there is one step after that. Because the city got into fiscal troubles in the 90s, we also have a state oversight body, the Pennsylvania Intergovernmental Cooperation Authority. They make us have a 5-year budget, not just 1 year, so that we aren't, using any gimmicks. And they also have to approve that 5-year financial plan. And if they don't approve it, they can withhold state dollars that otherwise would be coming to us and leave a big hole in our budget. So it goes through this process of first the mayor developing it, council weighing in and getting to a final 1-year proposal, and then PICA signing off on the 5-year financial plan.
And where are you right now in that budget process?
So right now we have just started on the operating side, getting ready for fiscal year 23, which will start July 1st of 2022. It's a little hard to keep track of how we label them. And so what we did about 5 days ago was we sent out a call to all the city departments and said, hey, what do you think you're going to need next year? Tell us how much it would cost for sort of status quo to keep doing what you're doing, because sometimes costs change even if what you're doing isn't changing. We also ask them, what new resources are you looking for? What do you want to do? And at the same time, we also say, okay, if you had less resources, tell me where you would pull back or where you would reallocate. So they both have the chance to ask for more, but also think through, okay, if they had to make do with less. Departments are going to get back to the budget office with that in the beginning of January. We spend January and February working on figuring out what everyone's asking for, how are we prioritizing. At the same time, we're working on what are our revenue estimates, how much money are we going to have. And then typically early March is when the proposal goes to council.
And just very quickly, what is the budgeting model that you use? I know there's a couple of terms, zero-based budgeting and things like that, but how do you look at the budget?
So we use what's called program-based budgeting, which is where we are typically tying how much we're spending to various performance measures. How much are we going to get? So when we look at a budget, there's numbers, we talk about dollars. Here's how much, the streets department gets. But we also might ask questions like, okay, well then with that much money, how many potholes will get redone? How much trash will get picked up on time. And so we spend a lot of time focusing our budget in terms of what are we trying to get for that money. There's a lot of different ways then to philosophically approach the budget. One of the things we've really been focused on for the past few years and will continue to make part of the effort is using a racial equity lens, understanding what disparities exist and how our spending decisions can help begin to eliminate those disparities.
Now, is the city right now on target to hit its revenue projections?
So we actually just released our quarterly report because the first quarter of our fiscal year is done. We actually had to lower our revenue projections. And so we do quarterly budget updates to make sure, are we on track? It's important to check. And where we're not on track, how do we make adjustments? And so unfortunately, we found that some of our revenues are not coming in as strong as we had hoped. And so we make adjustments. And so we're constantly updating throughout the year. So right now we are looking at coming in a bit lower than initially projected, but we've also found some savings, some other things happening. So we anticipate we're still going to end the year with a balanced budget. We also know that we ended last year with more money than we initially thought. So we're still in good shape for now, but things are constantly changing. And the tax projections are one of the things that give us concern.
So when that happens, when you have a readjustment that's lower than what you expected, does that then, do you look at that and say, okay, we have a plan for this, we kind of have an idea of what we would do if we have to live with this number? Or is it more of a reactive thing where you say, okay, this isn't what we were expecting, so we have to go back to the different departments and say, okay, those things that you told us that you might be able to do without, that comes into play now?
Yeah, so it's really a blend. Let me start by telling you what we can't do. Once the fiscal year is underway, we are by law not allowed to change the tax rates. So we can't go back to, Philadelphia taxpayers and say, give us more, we're going to raise your rates. So that's not an option. But luckily we do certain things. One of the things we put into our budget is a recession and reopening reserve. So we had already set aside a bit of a cushion for ourselves that we said, if things do turn out a little bit worse than we thought, or if there are unexpected new costs, we set aside a reserve that gives us some wiggle room. And that's just, really good sort of planning about what you would want to be doing. And so what we have in there for this year is about, let's see, in FY22, $42 million. So we've got that amount of wiggle room there. We also have a fund balance. So that's the first thing we can do, is we turn to our cushions. The next thing I turn to is what I like to call slam dunk savings. And this is why we're always in conversation with our departments. The only thing I can tell you for sure about a city budget is it never turns out exactly like we thought it would. And so you might talk to a department and find out, oh, they had some positions, they thought they were going to fill them, 6 months ago, but they're only getting somebody on board now. Well, means they probably struggled for 6 months, but also it means we saved 6 months of salaries for those positions. So those are some natural savings or slam dunks that we find. So we try and do that first. We might look at, are there different assets that we are selling or can do better, things like that. So the last thing we want to do is really have things that impact service delivery. So that's sort of our last chance, last option. It's something, we can do, and we work with departments throughout the year. And particularly, actually, we just in October went through what we call our target budget, which is where we check in with folks. And we say, okay, where do you have those slam dunks and natural savings? All right, if we had to do something else, what would it be? But luckily, we haven't had to do too many of those.
So it sounds like the budget up until a certain deadline is a moving target. There's always going to be fluctuations and changes. And is that deadline to say this is the amount of money we have is when the mayor makes his budget address, right around then?
So actually, it's constantly changing over the course of the year, because we're seeing how tax revenues come in. We're seeing what our needs are. So it's sort of, we started a baseline, but then we have to make adjustments throughout the year. For example, if we have a year of really heavy snows, we budget a certain amount for snow operations. But basically what happens if it snows a lot, January, February, we get the snow as best we can. And then we keep working to figure out, where else we can save money in the rest of the year. So there's a proposal. We can never spend more than the mayor's of the initially approved budget without council approval. We can only spend less. And so if we want to spend more in an area that we initially had approved, we then have to go back to city council and go through sort of an abbreviated budget process again, where we make amendments to the budget bill.
So what are some of the areas where revenue is falling short, and how much is that, do you think?
So I don't have great numbers yet, but the area we're most concerned about is our wage tax, which is our largest single revenue stream. So it is concerning when, a big source is having a problem. And a lot of the uncertainty with that stems from the fact that or there's two things. First, just generally the economy's recovery. We've seen some real strong recovery early this fall when schools came back. That meant that folks working at universities and other educational facilities, we saw those dollars starting to pipe back in. But we haven't seen as much of a return in hospitality, restaurants, things like that, hotels, in terms of the wages and folks there. And so that remains a concern, one, for the city revenues, two, for folks having jobs in those fields. And that's just general overall. But Philadelphia has the added wrinkle of we have a non-resident wage tax. If you live outside the city but come into work, you still pay the wage tax. But if your employer says, no, stay outside, stay home in your fuzzy slippers, don't come into the office. If your employer tells you not to come in, the tax is no longer due. You're sitting out in Bucks County, doing whatever you're doing, and we don't get that money. So we had initially thought, made some assumptions about how many folks would start coming back, how that would keep creeping up. But that pace doesn't seem to have been as fast for that return to office as we thought it was. And so we'd made some assumptions. Some folks we think are never coming back. We built that in, but we thought some folks would start to come back over the summer and fall. Doesn't yet look like that's happening enough. Maybe they'll all come back in the spring, maybe not. And so that's an area where we have a real concern and keep looking.
Okay. But you're
tens of millions of dollars.
Tens of millions of dollars.
When you look at the revenues that are coming in and trying to figure out what changes you may have to make to the budget as a result of a lack of revenue, is there anything that's off the table? Is there anything that you say, no matter what the financials say, we can't cut this or we can't do without this?
So in terms of on the spending side, we've got sort of three categories of costs. Some costs are fixed and we really can't do anything about it. It's like when we borrowed money in the past, we have to make debt service payments now. We owe that money back to a bank. We really don't have a choice. And so that's like that and pension costs that we have promised to our employees. Those are our real fixed expenses. Can't do anything. Then we have a category of what we call inflexible expenses. And that is things that are very hard for us to change without a dramatic change in government operations, the types of services that Philadelphians rely on. And so that has things like health benefits for current employees, because a lot of those are subject to union contracts. And so we can't change like how much we provide in terms of health benefits. We could only dramatically change how many employees we have. And so that would have a huge impact. And then, so, that's what we look at as about fixed or flexible. And that's about 50% of our budget of stuff that is really hard or impossible to change. So it means we have a lot less wiggle room when we get down to it. On the how we're raising revenue side, the things that constrain us most are the state constitution. There are a lot of rules about what we're allowed to tax, who we're allowed to tax, how much we're allowed to tax. We can't do anything that the state is already doing. And we also aren't allowed to have like a graduated income tax or property taxes. Everybody under the state constitution has to pay the same rate, regardless if you made $100 million or, if you made $35,000 last year. And so we have some real constraints on how we raise money based on state law and the state constitution.
Okay, now you mentioned the school district, and I know the school district and the city are two different entities, but the city council, does allot money for the school district. So when you all are putting together your budgets, do you sit down and talk at all about what the city is going to give, what you need, and how everything can match up?
Yeah, so those are conversations that particularly my boss, the city's finance director, and the CFO of the school district stay in pretty regular contact. So they're talking all throughout the year to understand what the financial picture is. And education is the area that under Mayor Kenny has had the most significant expansion in funding, whether it's direct funds to the school district that increase over his administration that has gone up by more than $1 billion, as well as other educational investments like PHL pre-K. And so we look at the picture of what does the school district need, but we also try and figure out, well, what else is coming in? So, there's a lot that we think state can and should do. But sometimes we have to recognize the reality that if other folks are not doing what we think they should, we don't want kids to be the ones who sort of are left holding the bag. So that's why we've increased the city contribution so much. And even this past year with stimulus dollars and new federal money. So we're looking at all of the different revenue streams for the school district, what needs they have, and how do we balance that against all of the needs just for city service delivery. But it has been an area where there's been a dramatic increase in funding from the city government over the past couple of years so that we can do more. But, as we all know, it still could use more.
Now, over the last year or so, when particularly the last budget, anti-violence programming and stuff to, try to turn the tide on the city's gun violence issues, that was top of mind from a budgetary standpoint, so much to the point that a group of councilmen threatened to not approve the budget unless there was money put in for that. Is that still top of mind in terms of the budgetary process? And if so, has there been any talk about adding any more money to the so-called peace budget?
So it's still a little early in the process for us to know exactly dollars, because we don't know yet how much money we have and what we're going to do. But anti-violence remains incredibly top of mind. And a lot of the money that was put in last year is recurring. So Bill sort of is in our 5-year financial plan. As I mentioned, we actually do a 5-year budget that gets approved by PICA. So a lot of that was already sort of built into our baseline and is still there for our commitment. And we continue to work with departments that are doing that anti-violence work. And it's really, different departments come to mind when we are rolling out the sort of 911 co-responder models and the mental health triage of 911 calls. That's our Department of Behavioral Health, our managing director's office, also 911, also the police department. So we're working with all these departments to figure out, the new money, how is it going, what's working, what's not. Evaluation is a really important part of this. As I was telling Larry earlier, we do program-based budgeting where we're really trying to tie what we're spending to what we're getting from it. And so the amount of dollars is really important to us, but we really want to make sure that those dollars are producing results. So we'll be spending a lot of time over the next couple of months evaluating where are we spending now, what are we getting for it, and do we want to do something different? Are there things we want to scale up? Are there things that make sense, to sort of wind down on? And that's the process we go through leading up to the budget introduction in March.
Okay, so you said it was a little early to talk about allocations. When does that conversation start? Because a lot of people will be like, okay, we need to make sure that what we need as a group or what we need as individuals gets into the conversation. When does that process start? And how do people, I guess, reach out to you all and say, hey, this is what we need. Please talk about this.
Thank you so much for that question. So when that really starts, historically, there have been opportunities after the budget's introduced for folks to come into city council to testify and that there are adjustments before council votes. And that usually happens in May. But one of the things we started doing over the last year was we were like, well, we don't want to get people's opinion after we put out a proposal. We want to get folks' opinion before we do the proposal. So in January and February, some of the work that happens is we hold a number of focus groups with different organizations. In past years, we've done surveys. And we also collect information from community leaders, and we try and figure out what, take the pulse of folks. What is it that they need? And so in January is when you'll start to see some of those opportunities for early community input. But then there's also the public hearings run by City Council in March and April. And so the public gets a couple different opportunities to share what they're thinking. But also, folks are always telling Mayor Kenny what they care about and their council members what they care about. And so that, as they're going through this budget process, is also top of mind as well.
And I know that you particularly don't have any, I guess, not necessarily interaction, but you may not know exactly what is going on with the American Rescue Plan money that the city got last year. But are I guess there's money that the city is also getting this year from the American Rescue Plan. Has there been any discussion on using more of it towards certain things like anti-violence prevention and education and different things? Have those discussions in particular started yet? And I ask about that money in particular because I think this is the last year we get it.
Yeah, so the money came in sort of two buckets. We have until 2024. And there's a couple different ways that you can spend that money. But generally, option one is like spending it to respond to COVID. And so that's what it wants. But the way that Philadelphia is doing it is something called revenue replacement. We can document that because of COVID, we're going to lose billions of dollars in revenue. So money that we thought we would get just to do our day-to-day services, not going to show up. And so by taking this in and saying we're using it for revenue recovery gives us maximum flexibility. So we can essentially, it just becomes a revenue stream to our budget and we can make whatever choices. So the choices we make for the upcoming fiscal year budget give maximum flexibility for those ARP dollars. We can do basically whatever is our most important priority. And we're not restricted because we're using it as revenue replacement to only do it for responding to COVID specific needs or certain federal guidelines. So that's the good news. We can, with those dollars, make decisions about what we want to do as part of our upcoming budget process. It's not separate from our normal budget process. The downside is while we're getting those as revenue replacement, it's still not enough to fill the hole that opens up. So we're still behind the eight ball.
Okay, we are here on WPPM 106.5 in Philadelphia with Dale Mezzacappa from Chalkbeat Philadelphia. Dale, thank you so much for being with us.
Thanks for having me.
So Chalkbeat just released the Philadelphia Early Childhood Education Guide. This is very interesting, and there's a lot in here that people should be taking a look at. So can you tell us just a little bit about the guide before we get into the specifics?
Well, Chalkbeat, as you know, as was the notebook before us, one of our major funders is the William Penn Foundation, which is very, very involved in the issue of early childhood and funds a whole lot of initiatives and reporting about it. And, you know, they don't tell you what to write or anything, but they want you to prioritize the issue, which certainly jives with what we would do anyway. So the notebook used to put out, when it was a print publication, used to put out a printed guide on an early childhood or an edition on early childhood. And so we decided to delve into the issue, but especially now because of the pandemic, it's so much more important because these early learning years are the most crucial in a child's development. They can chart their course, their life course, depending on what they have available to them in terms of not just academic, but socialization, and their brains are developing more quickly. And they just, if without good early childhood education and good early childhood experience as a young child, children are not as likely to graduate from high school. They're not as likely to go on to productive lives and earn good money during their careers and all of that. So we devoted this edition, and with an eye on the impact of the pandemic on what already was somewhat problematic in Philadelphia, as in most urban areas, to the extent is what quality is available to what percentage of the students who really need the service. So that's basically the origin of why we focused on this.
And you mentioned staffing there, and there's another article that I really would recommend people take a look at about care staffing across the Commonwealth.
Right.
According to the article, about 25% of the child care centers across the state have closed. What kind of impact and ripple effect does that have, not just on child development, but on families?
Well, it has a huge effect, obviously, because people who relied on childcare for their own employment, and we're talking mostly about women here. And women, as we know, have been more impacted by the pandemic or the jobs that they normally fill. And the burden of family responsibility, which has always fallen on them anyway. But it has made it less likely that people will be available for jobs if they can't find childcare. And so it has a ripple effect throughout the economy. And I think there are people who are studying this pretty extensively, but they are working very hard on building up the capacity. But again, they have staffing issues. And the story about why they have staffing issues is that another impact of the pandemic is that a lot of employers, private employers, Walmart's, Target, Starbucks, Amazon, they started increasing wages considerably in order to attract workers. And childcare workers make maybe $14 an hour or something like that. And if they can avoid the stresses of being with children, although it's a wonderful job in some ways, it can also be very stressful. If they can, patrol the aisle at Walmart with a lot less, responsibility and stress, or make your coffee, they might prefer to do that for more money. So the available pool of workers to work in childcare centers has shrunk. So that's another problem that the industry is facing. They are putting a lot of hope in the Build Back Better, because in all the negotiation that is still going on, apparently the issue about universal childcare, or that piece of it, has not been whittled away like some of the other pieces, and compared to President Biden's original proposal. But raising these salaries permanently, and recognizing the degree of skill required to do it, and not treating it like it's not one of the most important jobs in the society, is really the next step, or should be the next step, in making sure that all children have quality early childhood experiences.
And there was one quote in that story that was particularly illuminating, just as you mentioned. Somebody had said, you can make more money handing people a cup of coffee,
right,
than you can working with children, a lot of children, all the stress that comes with that, and the safety issues. These are not vaccinated children. You don't know. There's a lot of different factors at play. I have one-year-old that I chase around, and it's incredibly challenging. So looking at that staffing issue, you had mentioned that there's a lot of reliance on the Build Back Better plan, and also it looks like that some childcare centers are looking at maybe relaxing some of the education requirements that they required, and doing some other things. So what are some of the other maybe barriers to these kinds of jobs that now might be being eased for people?
Yeah, well, one person's barriers is another person's qualifications, so, but you can work at a childcare center if you have a high school diploma, but you have to be working toward a childhood development associate degree, or it's not a degree, it's a certificate really. so Pennsylvania has a system called Keystone Stars, which is a way to evaluate the quality of the childcare center. And it was an innovative program when it came in. It was very important because it worked to improve the quality of these centers and the quality of the experiences that children had in the centers. Centers get a star, stars up to 4 stars based on their, financial condition, their quality of their the experiences they're providing for the kids and other. And one of the things that figures in the Keystone Star system is the qualifications or the credentials of the staff. And so people who work there, and I highlighted this in the story that I wrote about the staffing, they need to get these credentials there. And there are people, conceivably, there was an op-ed in the Inquirer this week from someone who said, well, I have a college degree and I have this and that, but doesn't have the specific qualifications that Keystone Stars wants childcare workers to have, which, I guess one can talk about that as being problematic or something that should be worked out. But so the effort to improve the credentials that and the training that these childcare workers have is a good one. The issue now is that the people who might be available for these jobs, maybe high school graduates who don't have these extra credentials, but, are grandparents and have a lot of experience with children or whatever, they wouldn't really be eligible to work there. Or if they were, they would then have to start taking these classes. Now, there is also help for people to do that. There's a program called Teach, in which people can be enrolled in these classes, some of which are online, while they're working, and they get help, and the state helps them to earn the credentials. But the shortage is so severe right now that I think a lot of childcare workers, childcare centers are saying, even if we're going to risk our rating or something, we do have to just start hiring people who obviously are vetted and, for a whole lot of other things, but may not have all the credentials because they just need the bodies. They need people there. And, some of the areas that they're looking at are like maybe the families of the children who they actually serve, where the mother usually, and 9 times out of 10 or even more than that, it's the mother also needs a job and, looks to somewhat different staffing approaches in order to be able to enroll all the children who are, want the service.
I'd like to bring in Denise Clay Murray here on WPPM 106.5.
Thanks, Larry, and thank you, Dale, for joining us today. There was the part that kind of stood out to me in the early childhood series was the part on suspensions. Prior to me going into the classroom myself back in the early 90s, I didn't know that you could suspend kids in kindergarten until I actually, saw a principal do this. Can you talk a little bit about early childhood suspensions, particularly here in Pennsylvania? And is the staffing shortage somehow connected to that? Because if you had, if you had an aide with a teacher, you could possibly have that aide help you with your more problem students.
Right. Well, that issue, I think Ann Shimke, who wrote that story, she did a great job. The issue of being able to suspend and even expel the youngest children is something that surprises people. I also have taught a journalism class, and I sometimes talk about stories that I'm working on. And I mentioned the issue of suspending kids in kindergarten, and these students, like, their eyes widened. They just were like, what? But it's a real issue. And again, teachers are often overburdened, maybe too many children. Teachers in areas like Philadelphia, where you have a lot of children who have grown up in circumstances related to poverty and some degree of dysfunction or foster care. Even at very young ages, they haven't been well socialized. They haven't been in settings where they could develop their social skills. They may have some trauma that they're working out or anger that they're working out, even as very young children. And we all know that they don't have filters, they don't have boundaries, they have to be taught all that, or they have to be socialized into that. And they had no other option, teachers feel, but they can't really control their classroom or serve the other children in their classroom unless they remove them. That became a pretty big issue in Philadelphia years ago when I think it was then the Notebook got hold of some data on the number of kindergarten kids who had been suspended, and people were pretty shocked. And ultimately, the SRC, the School Reform Commission, which preceded as we know, the Board of Ed and ran the district for many years, banned the suspension of kindergarten students several years ago. So the issue of it gets into the other issue. It's all part of the same issue that we've been talking about: the availability of quality early childhood for kids, so that they're not just thrown into kindergarten, for instance, without having had any prior experience in a school setting. And even in preschool, we can see 3 and 4-year-old kids where they need more help than the teacher feels they can give them in a class where they may have 20 some odd other kids and not, no other adults to sort of help calm things down. I mean, if a child is hitting another child or biting another child, or, sometimes that happens in families, what do you do? So it's an issue, but again, I think the solution is more resources, more staff, and more training for people to, and more help available to the child's family than simply, throwing them out, essentially. There's various forms and levels of it, which Anne mentions in the story. Timeout is one thing, and, you send a kid to another room for a timeout or to sort of calm down. Is that is any time a child is asked to leave the classroom, is that technically a suspension? I mean, there's a continuum here, but certainly the issue of what to do about children who are not well enough socialized or able to take advantage of the setting that they're in a positive way gets back to the issue of resources, teacher training, family circumstance, all of that. So it's one lens it's another lens into the whole issue.
Now, the sweetened beverage tax, which was supposed to add more pre-K seats to the city's pre-K offerings. I was looking through some of the stories that were part of this package, and I thought, wasn't that supposed to take care of some of this?
Yeah, and part of the story that I wrote indicates that the city has added more, even with the staffing shortage. They have added more seats to the PHL pre-K, which is the city's pre-K program, feeling that it's necessary to do. And I don't know whether take care of it is the right way to put it, but the sweetened beverage tax is certainly helping to pay for the programming. Whether it's sufficient to pay for the needs that exist, and the other use of it's also being used for, I think, the creation of community schools. I mean, it's a question of whether there's enough. Nobody's talking about increasing the tax, but nobody's talking about getting rid of it either, that I'm able to figure.
Okay. Now, there was another story that was part of this. It said that Pennsylvania could get, universal pre-K, universal early childhood education. Um, is there serious discussion going on in Harrisburg about that? Because they've taken most of the money that they got, most of this money that the state got from the American Rescue Plan and put it into the rainy day fund. So is that discussion seriously happening?
I'm not an expert in Harrisburg, but I do know that among the things that relating to education that are consistently debated, universal pre-K seems to have more support than some other programs. If Build Back Better is enacted and funded at the level that they're talking about now in relationship to universal pre-K, I think that, it'll be used for that purpose in Pennsylvania, but whether or not that will meet the need is another question. How the money's going to be distributed, who knows? I think of all the things that are going on in Harrisburg, I don't think the Republicans are focusing their attention on thwarting universal pre-K if it should come to that and if the money's made available. But again, you never know until it becomes a reality and then becomes a bargaining chip, and circumstances and politics take over.
Okay, we are here on WPPM 106.5 in Philadelphia with Dr. Michael Lavasser, Assistant Professor of Biostatistics and Epidemiology at Drexel University. Dr. Lavasser, thank you so much for being with us.
It's a pleasure as always. I feel like I say that every time I'm on. It's a pleasure, but it genuinely is a pleasure to be here with you.
Well, we certainly appreciate that. And our listeners and our readers do as well, because they asked us to bring you back to talk about the new variant of the virus. But before we get into that, can you walk us through generally how a virus mutates?
Sure. And this isn't necessarily going to be the same pathway for every single virus. Some viruses have higher mutation rates than others. Some viruses have a completely different arrangement of their genetic material than other viruses. But for coronavirus in particular, has a fairly high mutation rate. And there's a couple of different mechanisms through which viruses mutate. One is when copies of the virus are made, they're not always going to be high fidelity copies. So sometimes one nucleic acid will be replaced by a different nucleic acid, just randomly. And a lot of viruses aren't equipped with the proofreading software that, for example, our cells have, to make sure that the genetic copy that's being made is the same as the parent DNA or RNA, for that matter. So when it comes to viruses, they do sometimes mutate at different rates, depending on the mechanism through which this natural selection is really is occurring. And then by chance alone, sometimes you'll have mutations that are more effective at doing certain things than others, either evading the immune system or by becoming more infectious, or a combination of the two things, or some other biochemical process that occurs. Just by chance alone, a mutation arises that does that. And that version of the virus will be more successful and outcompete the other viruses that are either present in the body or in the individual. And this can happen through a large number of mechanisms with a single virus. This is not an easy answer to give in a short soundbite. There are entire classes that could be taught on virology, just focusing on mutations. But there's a couple of different ways that Omicron in particular could have arisen. One of the interesting features of it is that it's not related to the other variants that have been circulating, alpha, beta, or Delta for that matter. It appears to be more closely related to the original strain that was running around last summer, which leads us to believe a couple of things. One, it could have come from an immunocompromised individual who had a very long-term infection, and these mutations just kind of rose up. It could have come from another animal reservoir. That maybe there were some animals that were infected with the coronavirus, and it was circulating in those separately, and we weren't watching them. And then eventually, a human got reinfected with this new variant. Or it could have just cropped up by chance alone in an individual and looks more like the original strain. That seems less likely with what we know about how things evolve. But there's a couple of different options as to how this came up. That's going to be a really interesting area of scientific exploration over the next few months. But there's no definitive answer as to how it happened here yet.
So even though it's early, are there any indications as to how severe this strain could be?
Yes, no, and more no. The yes is we do have preliminary information. I read yesterday out of South Africa, the region that's getting pretty hard hit by the Omicron variant, and it suggests that those who are showing up to the hospital don't even know they're infected. They're just coming to the hospital for other reasons. They are much less likely to require ventilation. They're not as sick. There's less shortness of breath. Now, granted, this is a population that is healthier. This is a population that is younger in South Africa in particular. That's a concern. Something like only 6% of the population is over the age of 65, and we know age plays a huge factor here. So we won't really know the answer to that question until we see this in different populations and can confirm the things that we're seeing. But also time is a factor. This is still pretty new. So we still it's usually about 21 days from infection to, on average, to death with the original Wuhan strain of coronavirus. So we're still waiting to see what happens among people who've been infected and see what happens when different populations are affected. But I think the early indicators suggest that there's reason to be hopeful that this causes less severe disease. That's not a reason for us to let up our guard yet. It's just a reason for us to hope that that things are improving.
And I'm taken back to something you had said to us very early on in our conversations. And I'm paraphrasing, and please correct me if I make a mistake here, but that as the virus went on, it would become less virulent and more communicable. It's not trying to kill anyone. It's not trying to hurt anyone. It's just trying to reproduce. And is that kind of what we're seeing right now, do you think?
Potentially. I mean, part of the issue with jumping to that conclusion this early is that we still don't know the mechanism or the conditions under which this particular variant arose. So if this just wound up being a completely different population, I don't know, birds or something, as an example, I don't even know if birds can get infected with COVID. I know mammals can. So maybe some sort of mammal population is better to imagine. Ferrets, I think, can get infected by it. Then the mechanism through which this evolution occurred was not in humans. So it could just be that because it was adapting to another animal, that's why things have changed, that could potentially make it less pathogenic, less disease causing. But in general, with the history of diseases, it's true that they can often evolve to become more infectious and less disease causing. And that is because viruses don't want to kill us. If you look at something like Ebola, has a very high mortality rate that happens very quickly. If you look at something like HIV, also has a very high mortality rate, but it happens less quickly. So HIV can evolve, doesn't necessarily have the selective pressure to be less deadly. But it depends on the virus. It depends on what's happening. But with something like the coronavirus, I would expect that the selection pressures, when you think about this from an evolutionary platform, the selection pressures would be such that it would become less disease causing over time, less severe.
And can we expect further mutations and variants?
Of course. Yeah, absolutely. Without a doubt. It just has a high mutation rate and there's a lot of community spread. So even if there's good news out of Omicron, then maybe the next one, I'm not familiar enough with the Greek alphabet to know what comes after Omicron. Is it not Mu? Zeta? Pi? Pi? Oh, Pi would be fun.
Omicron, Pi, Rho, Sigma, Tau, Epsilon.
There we go. All right. Well, maybe Pi will be, a different. But there is reason. I mean, it's going to keep evolving. The question is in what direction, and we just have to keep our eyes out and not let our guard down. And by we, I mean the scientific community, but also the public in terms of what we've been doing: social distancing, wearing a mask, making sure we're vaccinated, protecting our vulnerable populations, et cetera, et cetera.
Okay, I'd like to bring you Denise Clay Murray here on WPPM 106.5.
Now, first of all, thank you for joining us, Doctor. You said that, based on what, we're doing as a society in terms of social distancing and wearing masks and stuff, that we should be able to manage the variants of COVID-19 as they come up. But not everybody is doing that.
Mm-hmm.
And, I just saw something in the news yesterday that said that most of the current wave of COVID, resurgence is occurring in 5 states, one of which is Pennsylvania. The holidays are here. People are going to be having gatherings. Do you have any suggestions on what to do to keep your holiday gathering from turning into a super spreader event?
Well, I think the thing that I've been thinking about for the past 2 years is you've got to choose which events you're going to. Like, maybe it's really important for you to go to your family. Maybe it's also really important to go to your Friendsgiving, but maybe you shouldn't do both. Maybe you have to pick one. And if you really want to go to the holidays, we have cases. I've heard cases of people who went to Thanksgiving. A family member was sick, knew they had COVID, still came to Thanksgiving. Why would you do that? Like, are you new? Like, I don't understand why a human being would think that's okay at all. It is beyond my comprehension. But that's someone who's aware of their infection, and I don't think that's where the majority of infections are occurring. You have a lot of asymptomatic spread still happening. So if you think that you've been exposed, you can, from what I understand, the rapid tests are readily available at the not the grocery stores, the pharmacies. Mm-hmm. Sorry, it's been a whole day.
Although some of the grocery stores also have pharmacies.
They may, yeah.
So you're actually right.
So, it might be worthwhile before traveling to, do a swab, make sure you're doing it correctly, follow the instructions, and just check yourself out if you've got a little bit of a sniffle. I mean, we are seeing influenza creeping back up. We know that I had a really bad cold a couple of weeks ago. It was not COVID. It was right before Thanksgiving. Mm-hmm. There are other respiratory infections going around. So you just got to, be aware of where you are and what you're doing. And maybe there are some things that are less important. And you've got to pick and choose.
So since it looks like this is something we're going to have to manage, long term, what do you think that might look like? Is there like a national or local policy that we're going to have to adapt? And, if so, should I just get masks to match all of my ensembles to be on the safe side?
Well, why not? I'm actually a little surprised that masks haven't. I mean, not that I've been watching the runway, but that, that this hasn't become like a fashion thing that's been taken on. I'm sure it's coming along in the process somewhere. But yeah, sure, why not? Be fashionable and public health forward at the same time. We do that with shoes. Like, shoes are a public health intervention. You don't want to pick up all sorts of parasites and whatnot that you can on your feet, and that's part of the reason we wear shoes. So why not have cute masks to match? But yeah, I mean, in the long term, I'm not sure that I know what the way forward is. There are a couple of different ways forward, and I think that you'll see that enacted in the coming months. That there are some questions as to what the way forward is. If you were to ask me, there's no getting rid of this. This is here. It's going to continue to evolve. We have to learn how to live with it. We have to figure that out. And that means accepting its endemicity, that it's an endemic disease now that we have in our society. And what can we do to make sure that our hospitals aren't overrun, to make sure that everyone is as safe as possible? For example, easy policy we can enact right now. If you're sick and you have a plane to catch, you can get a refund. Like, why don't we have that policy? Like, you should be able to call same day and be like, hey, look, I'm coughing, I can't make it. Can I get a refund on my plane flight, on my plane ticket? Like, why don't we have that policy? And I guess maybe you need a doctor's note or something. I don't know how exactly that would work, but we need to accept that we need to Paid leave off. I mean, that's another big thing. We've been talking about that forever. You have a lot of people, especially like lower wage workers, who don't get sick time. Maybe they're part-time employees, so they will come to work sick. We need to end that. Like, there are big policies that we need to address as a country, as a state as well, to make sure that we have the best public health practices. Do I see those happening anytime soon? No, I don't. For a variety of reasons that I'm sure you can imagine. But we need to accept that the way forward isn't just to necessarily make sure that there's no more spread of the disease. I don't think that is an achievable goal at this point. I think it was at one point, but I think that the cat is out of that bag.
One of the things that I find myself bumping into on social media is when someone who is vaccinated contracts COVID-19 or one of its variants, the people who are steadfastly anti-vaxxers on my page say, see, that vaccine didn't do what you said it was going to do. This person ended up getting COVID anyway. Can you talk a little bit about what vaccines are supposed to do and what vaccines should not be expected to do in this case?
So what these vaccine critics, let's call them politely, for whatever reason, what they're referring to is sterilizing immunity, that something like the measles, you're exposed to it once, you're not going to get it again. You have a really strong, robust response. And measles, has a longer incubation period. So when your body encounters it, it produces antibodies pretty quickly and kills it off before it causes any symptoms. That's usually what happens. Coronavirus, you can start shedding virus the day after you've been infected, depending on the variant. So it reproduces very, very quickly, even before people are symptomatic. And so, you might have antibodies against it that are sort of like, attacking it one at a time, but like, the problem with immunology is that a lot of the analogies are military, and I try to avoid those analogies because they are more violent than I think they need to be. But it's just the way that antibodies work. They attach to the virus and say, and other cells come around and say, oh, hey, buddy, what you doing? They're like, oh, just hanging on a virus. They're like, oh, let me kill that for you. And then other cells come on and they attack it. So you need a certain amount of antibodies to be able to mount that response. And if the antibodies are just overwhelmed with the amount of virus that's being produced, then it's going to be some time before the immune response can ramp up. And the immune response can ramp up pretty quickly. It can double in size every day in terms of the amount of antibodies it's producing. But it does take time to ramp up that response. And so, yeah, people can still become sick. And by sick, I mean having symptoms. People can still transmit virus, but they will have less virus than if they were not vaccinated. They will get more sick than if their bodies were completely naive to the virus in the past. So what vaccination is doing here is it's giving your body a sense that, hey, this thing is here, and you're like, oh, I recognize that, I'm going to do something about it. But the number of antibodies that we have might not be enough initially to completely kill it off. Now, I think that's part of the reason why we're recommending the boosters, is because the boosters are going to ramp up your neutralizing antibody response. Neutralizing antibodies are antibodies that can attach to a specific region and neutralize the virus, making it ineffective. So the antibody actually sits on the molecular biology. There's this concept of the lock and key. So the spike protein, specifically the receptor binding domain, which I think a lot of people have heard about at this point, will attach to the ACE2 receptor on the human cell. When that happens, it's like a lock and a key, and the virus can enter the cell and begin to replicate. That's where the infection begins. Neutralizing antibodies will actually attach to the receptor binding domain. And have you ever tried to put a piece of tape over your house key and use that to enter your house? Like it doesn't work, right? So that's what the neutralizing antibodies do. I don't know anyone who would put tape on their key, but it's the analogy that came to my head. So that's the neutralizing antibody response. And so when you have more of those, you can actually achieve something closer to sterilizing immunity, but it's not 100%. And that's I think that's to be expected. I mean, all of this is normal with the immune response. But a lot of people also don't know that, and they don't know the intricacies. And maybe we need to teach that more in in high school or something. But I think that's where a lot of that confusion is coming from. it's a lot of nuance, and who wants to listen to me talk for that long?